Thank you so very much for stopping by. This article is called What is Black Fungus and Why is it spreading among India's COVID patients? This was done on May 13, 2021. It is called the black fungus and it can be deadly. It is also adding to India's growing COVID-19 woes at the moment. On Sunday, the Indian Council of Medical Research and India's Health Ministry issued an advisory calling for better awareness, screening, and management of mucormycosis, a rare but dangerous fungal infection. While exact numbers are not available, we're seeing a rise in cases in Delhi and Maharaja. Hope I said that right. And says Dr. Arpen. Oh my goodness, these names are so terrible. Well, hard for me to pronounce. They're not terrible, they're just hard for me to pronounce. A doctor, a scientist at the Indian Council of Medical Research and one of the experts who wrote the advisory. The symptoms of mucormycosis are mild at first and can be often missed in the initial stages. Dr. Ronak Shukala, an ear, nose, and throat doctor assigned to COVID-19 care at the government-run LG Hospital in Ahmedabad, treated a 35-year-old male patient who recently recovered from COVID-19. After being administered oxygen for a week in the intensive care unit, several days after recovering from COVID-19, the patient was back, complaining of an intense headache, pain in the sinus area, and the right eye, blurred vision, and swollen cheeks. An endoscopic examination revealed discoloration, a blackened area around the nasal sinuses. The disease progresses rapidly and attacks blood vessels and live tissue. Shukula says, as it kills them, it turns them all black, and that is where the disease gets the name black fungus. In just 3 days, it can spread to the eyes of the jawbone. In such cases, the only way to stop the spread to the brain is to remove the infected eye or jawbone surgically. Once it spreads to the brain, the fatality rate is over 50%. It's said to think that people who've gone through the immense distress of COVID now have to deal with a severe disability as well, he says. Mucormycosis isn't a new disease, Shukula says. It's caused by a group of molds called mucocermites. Individuals are infected after inhaling fungal spores found naturally in India's environment and soil. For most people with healthy immune system, exposure to the fungus really won't matter, he says. They won't get sick. India's current battle with the COVID-19 may be brewing many of the complications that are leading to an unprecedented rise in these cases. Doctors suggest India has reported 23 million COVID-19 infections and a death toll of more than 250,000 people, according for 1 in 5 active infections worldwide. Mucormycosis is an opportunistic infection. Mukajahiri says before COVID, people were far more likely to contract it, only if they were in a situation where their immunity was weak, says after an operation, prolonged hospital stay, or an organ transplant. But today, COVID-19 has weakened the immunity considerably, leaving more people vulnerable to the disease. Shukula says there are now more than 100 cases in public hospitals in Ahmedabad, when previously there were only 2 or 3 cases a year. People who have gotten sick with mucormycosis have had 3 factors in common, says Dr. Devashish Palakar, a psychiatry resident now treating COVID-19 patients in critical care at the government-run New Civil Hospital in Surat. 30 cases of mucormycosis have been admitted to the hospital over the past week, he says. The new cases are popping up every day. COVID-19 is the main culprit, followed by uncontrolled or newly damaged diagnosed diabetes, and finally, the added effects of steroids, which though are life-saving drugs, can render immunocompromised if used at a higher dose than recommended for a longer duration. We need to find a way to moderate the drugs, said Polakar, but with such virulent attacks of COVID, the patient might die without the medication. Treatment for mucormycosis involves identifying the condition in infected patients, quickly removing all infected tissue through surgery, and following up with an antifungal injection called anthropomycin B. An injection costs 3,000 rupees. That's $40 in India. It has to be administered every day for 21 to 42 days. States such as Mumbai are now making the injections available free at public hospitals since their cases are rising too. Rajesh Stope, health minister of Maharashtra, says the state may have over 2,000 cases of mucormycosis. Timely intervention helped save his patient, Shukula says. He did not suffer other complications. But the pandemic rages in India. Hospital hygiene will eventually need to come to scrutiny. If the hygiene in the hospitals isn't adequate, then the damp and dry surfaces, such as hospital devices and equipment, can breed fungal spores, exposing patients when their immunity is most compromised, Shukula says. COVID-19 patients using oxygen concentrators are also at risk, Shukula says. The devices are equipped with a humidifier bottle to prevent the patient's airways from becoming too dry while breathing directly from the concentrator, but it's where fungal spores can thrive. If the humidifiers are not properly cleaned or if they do not work, then the chances of contracting mucormycosis are higher, Shukula says. Even though it's an invasive disease, it can be treated, so there's nothing to panic about right now. The advisory was issued to create a greater awareness of the condition among the medical professionals who may not have seen many cases. At the moment, we need to suspect it early and detect it early to save lives, she says. Camilla, okay, that's it. All right. So they're having problems with this right now. It's a black mold. It attacks the sinus areas of the person, and the reason why is because things are unhygienic. They're not cleaning their stuff properly, or they're using it for too long without taking proper care of it. And also, they're saying things like a weak immune system, being diabetic, or had a organ transplant, or had something that compromised your immune system. That's when the mold can easily grow. I hope that this doesn't become a problem in America, but we know how people love to travel, and it's a possibility that this can be worldwide. This is a second problem that we have because of COVID. It's not just I can get this or I can get the variant or anything else like this. Even after you get over COVID, you still have some issues to worry about. They said that giving steroids at a larger than usual amount, or taking it for a very long time, the more than what you need, or taking the higher than recommended dose will also help you get this as well. People that want to deal with this at home have to be careful about this as well, to make sure that you clean your equipment, keep your tubes clean, keep your mask clean, keep yourself clean, keep your humidifiers clean. And it can spread from your nasal passages to your eye, to your jaw, and then it can go to your brain. So that's a big thing. Now, I don't mean to get all movie-ish on you, but there are a few movies, especially when they're talking about the apocalypse or something going deadly wrong to this earth. They usually use something like a black mold. Now, I've been looking at this little video game called Resident Evil. It's 7. It's a little video game, and I watch it on YouTube. I watch a whole lot of people play that game. And they keep referencing a black mold. And if we're not careful, and that seems like something that's very plausible. So, hopefully these doctors, now that they understand what's going on, they will really take care of their equipment and making sure that their patients are not reusing something that's already been used without being re-sterilized. And hopefully the people here and abroad take notice of this and be careful. Because this black mold, if it gets into you, if it has not, if it's touched your tissues, I think that's okay. They can get rid of it one way, but they said the other way to get rid of it is absolute surgery. And that is to have it removed, like surgically. And that may cause you to lose an eye or a part of your jaw or whatever sinus tissue it has attached itself to. Hopefully us here in America are aware of this issue, and we are seeing that we are taking care of this problem. But I'm thinking about more people that decide to tough this out at home. You know, maybe they have like an oxygen tank they want to use or something like that that'll help them. Make sure that you take the right doses of your steroids. Don't overdo it. Don't take too long. Don't take too much. Make sure that all of your tubing is clean. Make sure that the water that you're using in the humidifier for your breathing, for your oxygen tank, they have water that, you know, you put it in so your face doesn't get, so your nasal passages doesn't get dry. Make sure that that water is clean. I think the best kind of water for that is distilled water. I think that's the best. Make sure that your tubing and your facial things are changed often and they're not shared with anyone else. I'm going to say this is just another issue. Now, I've heard also in New York, they still have a lot of trucks, refrigerated trucks with bodies in them. I wonder what those look like inside. Like, is that mold growing there? I want to know. But I bet it is a horrible smell. I bet everything is just horrible about those trucks. But I would definitely like to know exactly how the body has decomposed with that COVID. I want to know what's the decomposition of the body, because it's been a good while that those bodies have been in those trailers. Even though they're refrigerated, it still has to go through some sort of a decomposition. So, yeah, that's definitely one thing I would like to look into. And when they plan on getting rid of those bodies, like, why are they saving them? Why are they still in trucks? That's silly. Now, thank you so very much for listening to me today. I really appreciate it. Please comment, like, and subscribe and share if you will. Thank you so very much for joining me.